All right, thank you for joining us, Andrea and Dr. Phillips again. So, Andrea, let's begin with you. So, how specifically has COVID-19 impacted Black and Brown communities, versus white communities?
Good morning. Thank you for having me. As you know, the Black and Brown communities across the United States, and including here in Nassau County, were hit the hardest. We see that even now with the Delta variant, our communities like Hempstead and Elmont and Freeport, those are where we're seeing the higher cases of COVID-19. And so we still have to be really vigilant and diligent about getting the vaccines into the arms of our community members.
So it's almost like a different things at play. There's getting it in the first place, spreading it, and then prevention with the vaccines. I mean, could you argue or say that in Black and Brown communities, overall health maybe is not where it should be, so resistance is down, and maybe that makes you more susceptible to
Yes,
virus?
Yes, definitely. Prior to COVID-19, we had various issues of health equity, including maternal mortality, infant mortality, high rates of chronic disease, especially the high rates of chronic disease were all factors that led us to have higher rates of death and morbidity from COVID-19. So these issues were very pervasive from the very beginning, and it's still issues that we need to deal with till this day. And hopefully long term, we could figure out better ways to improve the health outcomes of those in these communities.
All right, let's bring Dr. Phillips in on this. What is your take on that, Dr. Phillips?
Well, I would agree with what Andrea just said. I think that, we have seen a significant burden in Black and Brown communities. And a lot of it is because of things such as what she mentioned as healthcare disparities or chronic diseases that play a higher role. These same chronic diseases were those that put those individuals at a higher risk: heart disease, lung disease, diabetes, stroke, obesity. The other thing that we have in those communities is access issues with quality medical care. So you have an abundance of people that don't even have a primary care physician to go to. Originally, I'm from East Elmhurst, Queens, New York, and I know a lot of individuals in my community, which was hard hit last year, weren't sick enough necessarily to go to the hospital, but were sent home. And then they weren't sent home with proper instructions on how to protect themselves and those around them. So we saw that the virus would run rampantly in those areas. And unfortunately, these same type of disparities have carried over even into vaccine distribution, which has led to some, disparity in the numbers of African Americans that had vaccines available in comparison to other communities.
Yeah, we heard many levels of government, from federal, state, county, and local, saying they're putting a real focus when the vaccines first came out, just making sure they distribute to minority communities. But whether that happened or not, the jury's out. But